I'm going to be reflecting on patient Nina Wills, who dislocated her knee a few weeks ago and is rather anxious about full weight bearing and taking her brace off. She was already seen by previous physios in the orthopaedic team, therefore we knew she already liked horse riding. And to do this, I'm going to be using the Roffel et al. 2001 reflective model, which is basically 3 simple questions: what, so what, and now what. So to begin with, I'm going to be reflecting on the 5 areas tool. So in my video when looking back, I often looked at the model instead of, so like the model was on my screen, so often looked at the model instead of like engaging with the patient and like giving good eye contact. The use of the model was like a good example for the patient to look through the steps, but it's important to like explain better and be a bit more engaging with like body language and eye contact and non-verbal communication. Looking back on this, I can see that my patient was not as engaged, like Nina wasn't as engaged when I was like going through the model, because non-verbal communication is really important to like for people to have better engagement. Can et al. 2014 says that evidence shows that physician non-verbal behaviour leads to a higher patient satisfaction and patient engagement. And I have the knowledge and eye contact. And I have the knowledge that eye contact for me can be quite difficult, and understanding this for future practice will allow me to focus on this and make it better. I'll be doing this by just in my everyday life, focusing on making better eye contact and being a bit more engaging and enthusiastic about things. Even like facial expressions and stuff like that, just maybe making it a bit better throughout like my communication. Because I've kind of realised how important it is when watching back, because you can see the difference it kind of makes with someone who's engaging. Like even thinking back on it myself, if someone's listening to me, I feel a lot more listened to, or like I feel a lot more confident in what they're saying if they're engaging with me and using their non-verbal communication. Moving on, when she talks about her friend who has done it before 3 times, I kind of realised I didn't really go into deeper detail about this and explore or educate her on the importance of her like thinking unhelpfully like that. It kind of made me realise that I need to go into more depth about some of her thoughts. Because if she's having this kind of anxiety, it's important for me to like educate her that other people like might be affected in different ways, so that she's not influenced by this like kind of like this other person who's dislocated their knee multiple times, because that will make her more anxious. So important to maybe dive into that thought as well, and because that probably would help for her future if she kind of like understands it, maybe is educated a wee bit more on that. So as a result of this, I need to like explore the patient's thoughts to gain a better understanding and allow me to educate her more efficiently. When summing up the model, I feel like I could have went into more depth as well regarding like the links between each of the different areas, just to give Nina a better understanding of the model. And I think like by looking back, I think she was maybe slightly confused about how it linked back, and I moved on quite quickly into the next kind of model, which I do think was good because it did link, and it kind of got the behaviour from the 5 models tools and kind of used that in that, but it would have been better to maybe sum it up a wee bit better so that she understood the importance of it. So in order to improve this in the future, it's important for me to acknowledge everything my patient said by using open questions and things like that to explore more further into detail. A study by Takamura et al. 2005 states that the use of open-ended questions is beneficial for gathering more healthcare-related information during any form of conversation and interviewing. Moving on as well, during the model, I think I was able to go through each step quite smoothly without any issues. This made me more confident to use it in future practice, because I was able to kind of break it down and use my own words and my own kind of way of doing it, so that allowed me to feel a lot more confident in myself, and it felt like more natural than previous times because I'd kind of had more practice on using it. I feel like I could use it in future practice a lot more. This will allow me to take it into future practice and know I kind of have more confidence, like know I have the confidence to use it, whereas before I maybe struggled a little bit with this. So when reflecting upon, and I think if I have confidence in myself, it might reflect onto my patients and they might feel more confident in me because I'm being more affirmative and more understanding. Nuffled Trust 2018 states that trust and confidence are key components of clinician-patient relationship. There are many benefits that can come from a trusting relationship, including open communication of information, improved adherence to medical advice, improvement of health outcomes, and better patient experience. So to take this my practice to the next level, I will continue using these techniques, which will hopefully help me become even more confident and allow me to have better relationships with my patients and make them feel more confident in me as well. I think looking back, probably the most important one for me was the being more engaging and using like more of my personality through conversations, like facial expressions, eye contact. I think that was probably the most important one for me.